Many of us think that writing a discussion is the easiest part of the paper. Generally, what is commonly done is you write a few sentences and put a few references and then conclude. But increasingly, there is a need, felt necessity for structuring the discussion. So soon we may see a structuring of the discussion in most of the medical journals. At present, still it is not structured. Generally, there are two aspects, there are two schools of thought. One thinks structuring imposes a limitation on the literary abilities of the author. The second group thinks that structuring is not necessary. Leave the authors free, let them speculate, let them write what they want, right? But today what we will be following is a semi-structured pattern of discussion, right? So discussion is to answer this question: what do your findings mean? Okay, what results you have derived from the study? So what is the meaning of these results? That is the purpose of writing a discussion. So there are three parts in a discussion. First is the beginning. Answer the question. So answer the question which has been asked in the clinical trial or your study, like comparison of such and such a thing with something for some effect. So answer that question: what has happened? What conclusion you have derived from your study, right? So answer the question and support the answer. Why? Like suppose you have measured pain scores in your study. Tell that this drug is an effective analgesic. Why? Because it has reduced the pain scores in my study. So the beginning of the discussion, answer the questions and support the answer. Right. Generally the beginning of the, I'll tell you how exactly to write the beginning. So group 1 writes the beginning. Okay. This will take just 5 minutes. Group 1 writes the beginning. Group 2, the most difficult task is for the group 2. Assess your findings in the context of what is known. Previous trials, previous data, animal studies, so whatever is known. Okay. So what are the parts of this middle part of the discussion? We will we'll discuss in detail what are the parts of the middle part. End. Restate the answer. Again restate the answer. This again is a 5-minute task for group 3. Okay, conclude and what further needs to be done. So the first lesson, whether your expectations at the beginning of the trial or at the beginning of the study, are they fulfilled at the end of your study? So that is what you write at the answer, in the first part, in the beginning of the discussion, right? And in the later part, does it affect clinical practice and the theoretical consideration or the rationale or the basis behind why it affects the clinical practice. If your results are agreeing with the previous work, fine, no problem, right? You are just adding to the knowledge. If it doesn't agree, then you need to explain why it doesn't agree. And if you are not in a position to explain, please do not explain. Okay, we do not know why our results are like this. Leave it at that. Leave the answer unresolved. So beginning of discussion, these are the parts which I need. Answer the research question, signal the reader what to expect. Okay, it is an analgesic, it is not an analgesic, it is working properly, not working properly. And be sure that the conclusions are supported by the results and the methods. What statement you write at the beginning of discussion should be supported by the results and the methodology. And give the strongest result first. There is a single aim of a study. Give that result first. Whatever secondary conclusions you have drawn from the study, you can give, but at the end. Okay. So at the beginning of the beginning, give the strongest result. At the end of the beginning, give the weakest result. Right? This will make your task very easy. End of the introduction. End of introduction, we aim to study the effect of so-and-so drug. The beginning of discussion. In this 8-week study, the same drug significantly improved symptoms in patients with such and such a disease. So the end of the introduction becomes the beginning of the discussion. Okay, you're following this. It should be pretty easy for you to write. Middle of the discussion. Most difficult part, middle of the discussion. Okay. So interpret the results. Interpret the results. I'll just not read it out to you. The group 2 can read it by themselves. I'll just give you 2 minutes to read this. Okay, I have given that to you, that and I have annotated the part, middle of the discussion. So, interpret the results, explain the meaning of the findings. Okay, explain the meaning of the findings without appearing very spectacular. The study which I have given you is a new herbal formulation, and supposedly the authors find that the new herbal formulation is superior to a already established non-steroidal anti-inflammatory drug. Okay, so just state that fact. Do not say it's a very exciting finding, it's an important discovery or something. Okay, nobody is going to believe you if you say so, right? So without appearing to be arrogant, do not be arrogant or patronizing. The reader should think, yes, this is such a simple thing, I should have thought of it before, isn't it? Okay, so that is the aim of the middle of the discussion. And absolutely, if you do not keep your language simple, nobody is going to read and reread the discussion again. Nobody will go through the effort of reading the discussion again. Compare your work with the work of others. In this trial which I have given you, probably there is only single other published work. So compare that with the already published or already done trial, right? And discuss the comparisons between your trial and the other study which has been done. Consider alternative explanation to your findings. If your findings differ from what is known, put forward some explanations as to why they differ from what is known, right? The purpose of the study is to discover the truth, okay, and not to prove anything. Like somebody has said, okay, it may be, like all of you know this methi seeds. Somebody says it is it decreases the serum cholesterol levels. Do not set out with the aim of finding or the aim of saying that this drug will decrease serum cholesterol. Just do a trial and find out at the end of it whether it is going to decrease or not serum cholesterol. Okay, that's the way you need to proceed. And consider all the explanation for the results rather than your mindset. It should be hypocholesterolemic, and then design a study and then design your discussion to prove that fact. Okay, do not do that. So the reason for medical research, I'm very sorry for other subjects, if there are people from other subjects. The reason for medical research is to improve patient care. Even animal studies have some implications for patient care. So most of the studies which most of the discussion which you write, you should at least have one sentence stating the implications for patient care. What can be done for the improvement of the patient. This is a laboratory study. This is a laboratory study, and they have discussed the implications for the patient care. Okay, it's a bit complicated, but they have discussed the implications for patient care. And describe the limitations of your study. This again comes in the middle of the discussion. Describe the limitations of the study. Okay, and one clue, if many of you are not very familiar with clinical trials, and especially in a disease like osteoarthritis, which I have given you, and if the symptom score involves assessment of pain. Pain is a subjective symptom, and no open study, it's an open study, it's not a double-blind study. No open study can assess pain properly. Okay, that's one limitation of your study, right? So like that, discuss the limitation of your study, right? So here, in this study, they wanted to study only non-ulcer dyspepsia, but unfortunately because of some problem, they have taken about 40-50 patients with some amount of reflux. Okay, reflux was an exclusion criteria for the study, but some patients with reflux were also studied. That is a limitation to the study. Okay. Again, same. We can be very frank. We used only white subjects, so the results cannot be extrapolated to any other population. Okay, you can be very frank in discussing the limitations of a study. Group 3, end of the discussion. Explain all the unexpected findings. Include speculation. Okay, so you can speculate on the mechanism of action of why your herbal drug may be effective in osteoarthritis. if there are animal studies or something else to support the data. Okay, you can speculate. You can speculate a bit. Okay, and please be sure that your speculation is supported by some data, by some animal data or some data. We do not speculate just like that. It may be, it may not be. Do not speculate without any data. Write a firm conclusion and mention if there is need of any other studies, any further studies. This is again a beautiful end of the discussion. I have given it to you, that paper. Okay. So exact mechanism they don't know, so they have written, it remains to be established, and further clinical trials are necessary. Okay. So the end of the discussion should mention this. So the recommended length is 2 pages, not more than 2 pages. Do not ramble around, do not write anything which is not needed. Okay. So think before you write, and these are some blunders which have been appeared in real journals. Okay. Naturally, when history writing, many of us, many of the junior residents write, patient complained of coma. How can a patient in coma complain of anything? Okay, patient complained of coma, something like that. So the second school of thought about speculation. So this is a beautiful diagram from the British Medical Journal. So he says, you have to speculate to accumulate. If you do not speculate, you cannot accumulate. Right. So this is the structural convention I was telling you. This is the proposed structural convention for writing a discussion. So first, the statement of principal findings, that is the beginning of the study, beginning of the discussion. Strength and weakness of the study. Strength and weakness in relation to the other studies, middle of discussion. Meaning of the study, that's again the middle of the discussion. Unanswered questions and future research and speculation towards the end of the discussion. Okay, this is a firm lesson. So they say speculate, but let there be a basis for your speculation. Okay, these are things to avoid in a discussion. Over presentation of your results. Unwarranted speculation without any basis, do not do. Do not speculate without any basis. Inflate the importance of your findings. Yes, this is going to change medical practice forever, nothing like that. Tomorrow you will have a clinical trial which states that go back to square one or something. The bully pulpit. The meaning of this is, you compare your study with other studies. Do not criticize other studies. Suppose other study has some weakness, just mention the weakness. Okay, the study which was done had the following weaknesses which were addressed in my study. That's it. Okay, do not write anything beyond that. Do not use this as a tool to destroy your rivals. Do not use it as a tool to destroy your rivals, and do not draw any conclusion not supported by the data. You do not draw any. Suppose I think still I'm using pharmacological lesson, like for a seizure, there are several types of seizures and several models of seizures in animals. If you find a drug effective in one model which represents one clinical model of seizure, do not say the drug may be effective in some other model. Do not draw that conclusion. Okay, do not draw conclusions which are not supported by the data. Thank you. This lets you with the thought that to speculate or not to speculate. So group A, 10 minutes for the lesson, and then we'll discuss the implications of the study. Sure.
There could be many risk factors.
Yeah.
For each of these risk factors, we need the same format of discussion, because we need to answer the same thing.
Yeah, you can answer each one of them in a different. Yeah.
In the same format.
Yeah, in the same format. Same format.
So you said the research question.
One patient dropped out of the study after 1 week.
Boswellia serrata extract more effective than valdecoxib in the treatment of osteoarthritis of the knee. So the answer is yes, and this is being supported by the fact that they use a Womack scale, which is a modified form of the visual analog scale, 0 to 100. What they see was, okay, in that particular Boswellia serrata extract group, pain, stiffness, difficulty in performing daily activities showed statistical significant improvement with 2 months of therapy, which even lasted till 1 month after stopping the intervention. The same is correct for the case of baldacocib, except that there is no follow-through action in the case of baldacocib. When you stop it, action doesn't last. That was the difference, therefore. I think this answers the question.
Okay, yeah. There are two differences. One, the onset of action of baldacocib was instant.
Yeah. And
Right.
takes 1 month.
This takes 1 month
Yeah.
for the action to start. Right. Rest of the thing which he said is okay. Okay. This simple beginning of the discussion, middle of the discussion, group 2. Come, just the 4 or 5 points which we discussed. Come. Yeah, I'm really this one because discussion itself takes a lot of time. Right. Okay, you need to understand the whole paper and then write the discussion. Here we are just trying to bring out a few points which in which this paper is deficient. Right. Okay.
The first thing that we found out was there was no structure. I mean, the paper wasn't structured in introduction, materials, and methods, results, and all that. And in the discussion, they had put some results, like when he had said that we had planned to perform arthroscopy in 5 patients. This possibly would have been better in the material section.
Material, yeah. So
explain
there's a mixing of contents. Good.
The second thing, they have only pointed out one study, 32-week randomized placebo-controlled study. They've used the visual analog scale, and they have mentioned nothing about blinding anywhere, whether it was a blinded study or whatever. So that's one thing they should have mentioned. Then we found that the comparison also we did not think was very strong. I mean, 1 or 2 papers they have reported here and there, but they hadn't really structured it very well. The whole discussion, I mean, the comparison with other studies found and all that. Yeah, at one point they mentioned that one patient dropped out of the study, but again they speculate whether the diarrhea was due to BAC or other causes is difficult to predict, which they possibly should not have done.
Yeah, they shouldn't have speculated what was beyond this one. Right. It could have been a traveler's diarrhea or just a non-infectious food poisoning or something like that. They shouldn't have done. Good.
I cannot find anything on limitations of the study that they have mentioned here.
Yeah, the major limitations of the study, if you are not doing clinical trials, is first thing is it is open. Okay, the major problem with studies on pain, if it is open, okay, take yourself for example. If you go to a doctor, if any of you go to a with pain, and he says it's a new drug, it works wonderfully, and if you take that, definitely your pain will go. Okay, whether the drug is effective or not, you will report a decrease in pain, right? So, open study of anything analgesic is generally not done and not accepted. Okay, so the major limitation of the study itself is the design. It shouldn't have been open. Okay, but the problem is they are comparing an allopathic drug with a herbal formulation and blinding meaning making the 2 drugs appear similar in color, size, shape, taste, everything is extremely difficult, right? So they have their own limitations. The study has limitations because of that. These should have been brought out in the study. This should have definitely been brought out in the study. And the study with which they are comparing, there is absolutely no, they have just mentioned it's a randomized trial, right? I think it is wrong. The study, they are not quoted the reference properly, and we do not know whether it was a double-blind placebo-controlled trial or what was it. We do not know the design of the comparative trial. They are not compared properly, right? And they have drawn conclusions, right? Some of the mechanisms which they have proposed from animal studies. It's okay. That much of speculation is warranted. Okay, good. I think given the time, given the time constraint, they have done a very good job.
When it comes to the end of the study here, in the summary, it is ending abruptly.
Very good, very good. They just abruptly ended the this one.
Though there were some of the side effects or whatever they have seen, but when compared to valdecoxib, though they have said that it's reduced, so any further study can be taken to evaluate the side effects of those things. And it's an open label. Can any other better method of study
Design.
They can adapt to do
Design.
the things.
Okay.
That's it. Thank you.
Okay. So in conclusion, they should have stated that, yeah, further this evaluation should be done by double-blind randomized controlled trial, and further studies on the mechanism of action, how this drug acts, that should be undertaken. Okay, and the reason why the effects persist longer than the duration of treatment should be investigated. Okay, so these are the things which they should have brought out in the conclusion of the study. That has not been done. Overall, if you look at the beginning and the end, they have no this one. Okay, it's quite a this one. If you look at the middle of the study, this study shouldn't have been, could have been done in a proper way. Okay, so that's the conclusion of the discussion section. This study could have been done in a proper way, in a better way than what has been done. Huh? Yeah, I think you can answer. How sound is it ethically? See, like many other places I know of, have ethical committees which can be convened, called up in the morning, convened in the evening, and the paper is passed the same day. So ethical committees, so that's the main problem with the ethical committees. Okay, thank you.